Hello, and welcome to Healthy Living. I'm Dr. Donald Pelto. I'm a foot doctor in Massachusetts, and I'm going to be answering some of the common questions I get every summer from my patients about their feet. The first question is, how can I get rid of my heel pain? To start out, I want to explain a little bit about what heel pain is. Heel pain has another name that's kind of complex. It's called plantar fasciitis. Now, what is the plantar fascia? The plantar fascia is a ligament that goes from the ball of the foot all the way to the heel. It's about this thick, and it's a secondary support structure of the foot. Well, meaning secondary because it's not really supposed to bear your weight. What's the primary support structure? Well, those are the bones, tendons, and muscles and ligaments that are in your foot. So if the bones aren't doing their job, or if the tendons aren't doing their jobs, then what happens is the plantar fascia has to take care of all of the weight bearing and taking away all the pressure on the foot. This area tends to get inflamed. It gets painful. The most common problem that people have is pain when they get out of bed in the morning. So imagine if you get out of bed in the morning and you're starting to limp around as you go to the bathroom, you probably have plantar fasciitis. Also, if you sit down at work for about an hour or two and then you get up and it starts to hurt, you probably have plantar fasciitis. But you may ask, don't I just have a heel spur? Well, here's a picture of a heel spur. You can see the large spur that's in the bottom of the heel. The spur usually isn't the problem. In the past, we used to remove the heel spur surgically. We used to go in there, make an incision, and rasp off some of the bone, thinking that that would resolve the problem. Sometimes it did, but many times it didn't. That spur is actually caused because of the tight pressure and pull from the plantar fascia. If you pull in a bone long enough, it's going to develop a spur in that direction, and one of the areas is on the bottom of the heel. So how do you treat plantar fasciitis? Once you determine what you have, then you have to do three things. You have to reduce the inflammation, you have to reduce the tightness, and you have to stabilize the foot. So let's first talk about reducing the inflammation. Inflammation is the pain that you feel when you get up in the morning. Inflammation is the pain that you have on one foot and not the other. The inflammation has to get calmed down, and before you see a doctor, you've probably taken anti-inflammatories, you've probably iced the area, and some people even take a bottle of water, put it in the freezer, and roll it on the bottom of the foot. That's all fine, but your foot still hurts. By the time you come to the doctor's office, we actually take something and we inject a steroid in there called cortisone. Now you may think, steroids are dangerous. Well, it's not that type of a steroid. A steroid, you can use it up to 3 times in the bottom of the heel, and that's going to reduce the inflammation. Because right now, your foot is stuck in a chronic pain cycle. You get up in the morning and it hurts. You start to walk and things loosen up and it feels better. But then when you sit down and get up again, it hurts. And you have to use the cortisone to reduce that inflammation. The second type of treatment is to reduce the tightness on the bottom of the heel. Before you come to see the doctor, you probably tried the runner stretch where you push against the wall. You may have tried going off the side of a step and loosening up the Achilles. All those are good, but by the time someone comes to the doctor, you probably need some physical therapy, and there are some special tools you can use. In this picture, you're going to see a foam roller and also something called trigger point tools. Both of these are guided towards reducing the tightness in the back of the calf. They can be very helpful, and there's also one other technique called the Graston technique, and that's used by the physical therapist. That's actually where they take a hard piece of metal and they rub it down the back of the Achilles tendon to reduce the inflammation. That's the second thing you have to do. And the third aspect is you have to stabilize the heel and support the foot. Most people, they use the worst shoes for the hardest activities. And if you're wearing improper shoes or shoes that are too old and you do a lot of walking or you're wearing a flip-flop that doesn't have any support, many times you can aggravate the plantar fasciitis. So to start with, I would say go to a very good sneaker store and get a good shoe, preferably a running shoe. But you may say, I'm not a runner, I'm a walker. But I still say, get a running shoe because it has the best technology in that type of a shoe. And you can also try an over-the-counter insert. Many people buy them over the counter. I don't really recommend the soft ones, so let me explain. Here's an example of an orthotic. This one's made with carbon graphite. It's very rigid, but it has some give to it. And if you look at the arch can't be pushed down by my finger. You want something that's stable. If you find that the device that you're using, you can bend it or it collapses, it's not really doing anything. You need a device that can support the heel of your foot and support the arch of your foot and allow the foot to relax and rest. It's going to do the work for the foot. Not everyone needs orthotics, but orthotics can help you, especially if you do a lot of walking and if you do a lot of standing at your work. But let's say you don't want to go to the doctor. What are some of the home treatments you can do? You can ice it, you can take the anti-inflammatories, you can try the stretching, you can try to take an insert and put it into your shoe. Those all can be helpful. But if you have heel pain for over 6 months or over a year, don't wait. It's probably not going to get better. I have people come in that frequently say, if I just wait a year, it's going to go away. Well, if it's not better probably in a couple of months, it's probably not going to get better. In some people, they need some advanced treatments. Let's go over some of the advanced treatments for plantar fasciitis. One of them is called platelet-rich plasma therapy. That's where you draw some blood from your arm and you spin it down and you take only the platelets and you inject those platelets into the area of the plantar fascia. What those do is those actually reduce the inflammation and bring the healing components that you need for the plantar fascia to get better. Now, we don't do this right away. Many times we've already tried 3 cortisone injections, we've done physical therapy, we've done an orthotic, and if none of those work, then we do this as an advanced therapy. Another type of a therapy, the second one, is called shockwave therapy. Shockwave therapy is very similar to something called lithotripsy if you've ever had kidney stones. It actually uses sound waves to hit the area of the plantar fascia that's thickened and inflamed, and it allows more blood vessels to go there, and it helps to heal the plantar fasciitis. And then the third type of treatment, it actually uses stem cells. And you take the stem cells, inject them to the area of inflammation, and it can help with healing. All of these are used after the other traditional treatments aren't being effective. So I hope you found this helpful, and if you want to learn more about plantar fasciitis, you can go to drpelto.com to learn more.